Now, please join me in welcoming Dr. Ricardo Affonso Ferreira, co-founder of the Expedicionários da Saúde, to the stage.
Good morning. Thank you. Okay. Good morning. I've been working in the Amazon forest for the last 23 years, taking care of isolated indigenous people. We bring a mobile hospital to the middle of the jungle so that they don't have to come out to have their health taken care of. We do mostly cataracts and hernias. So we avoid that these people have to come to the big cities. One thing that I notice here in all these speeches and talks is what we do. We here from first world, we who have the money. And one thing that I think that we have to learn is we have to hear what is in there. We have to hear the indigenous people that are isolated. What do they want? Not what we want. It's very important to know that. At the beginning, this 20 years ago or so, I went with them and I saw that they had no facility whatsoever for surgical care. I am an orthopedic surgeon. I do total hips and total knees. But being there in the Amazon forest, I saw that what they needed really was hernias and cataracts. They get blind in the forest very, very young, and they cannot carry weight either. So we have to look at what they want, not what we want. The solutions are not in London, New York, or even Abu Dhabi. The solutions are in the middle of the forest, are in there. They are going to give you the answers of what they really need. These years, during all these years, we grew a lot, and you can see here a picture of what is a reserve, indigenous reserve, and what is white man's land. The forest is totally destroyed, where, there is no, whereas Indian, it's green, totally green. The rest is white. So it's quite obvious that they really take care of the forest. So they are the guardians of the forest. So we need to talk to them about how to preserve this, not talk to us. These guys are the guys that we treat. As you see, you have the Suruaha over there. They've been in touch with us, with the Western society for less than 50 years. And then you have the Xingu people, you have the Munduruku, you have the Kayapó. You have hundreds of people living in the Amazon forest. It's bigger than Western Europe, but only 400,000 people live there. And each of them have a different necessity and a different solution for their problems. What we have to do is help them. Give them a minimum of citizenship, that they be proud of being part of our world too. That we don't only come there and take it out, take everything out, destroy everything. Xingu is a good example. These guys in the middle here, these guys in the middle down, they've been in the park for over 60 years. They really preserve their place. But now farms are encircling them and polluting their waters. At the same time, in Brazil, everybody is very happy. Oh, we have a very strong agriculture model, but that is very, very destructive. Here, these green parts is the part that we've been over this last 23 years. So you can see the indigenous territories are big, and there is no doubt that in indigenous territories, the forest is preserved because they've been doing this forever. They're semi-nomads. They live in a place, then they move, and they keep on moving and coming back to the same place a year later or so. Here in this place, here in the corner there, southern corner, is Javari Valley, where are the most place in the world where is the more indigenous isolated people in the world. Many, over 100 tribes that had never been in contact with the white man. And we cover an area around the size of France where there is no more cataracts and hernias. Of course, there are going to be new. We go to a place and then 5 years later we go back because there will be new cataracts. Cataracts is a disease, is an ileosis, comes from the sun. So in the Amazon forest, they get blind around 50 years old or so, or like our little girl Sarah here, which has congenital cataracts, or with young ladies like Daniela that I'm going to show very soon, who has diabetes but couldn't take care of it, so she had cataract due to diabetes. Oh. This is our hospital. This is our mobile surgical center. You have the big one there. There we have 5 rooms, and we do over 500 surgeries a week. It takes sometimes to set it up, like 1 or 2 days to set it up, and then we work for 7 to 10 days. All our doctors are volunteers and nurses. We are only 7 people hired to do this that we've been doing for the last 23 years. In the last expedition, in a week, we did 550 surgeries, and we had over 40 doctors working 14 hours a day, something like that. On the side here, you have gynecological room, ambulatory. Women is very important to listen to them. So in every expedition, in the middle of it, we stop for one afternoon and we have a round of talk with them to see if what we're bringing to them is what they want, and to learn with them what we're going to do new for the next time, so that they bring us conversation. And in women, we have a special program for women, and it's only women. All the doctors are women, all the nurses are women, all the patients are women. So, and they talk. Women like to talk. And they talk, and they make many decisions changing the way that we see this. And we focus on something, on some pathologies like cancer, uterus cancer, which is a disease that is deadly, but it takes a long time to grow into cancer. So we can take their lesions and we get an anatomopathologist with us, and so we can decide right there. We don't have to send them to no place to be taken care of. We start and finish right there. This is Dona Elza. She was blind. She was totally blind. And that's how she went into our place where we're having our mobile center. She had to walk with her grandson. You see, she couldn't see, so he had a stick, and the kid will take her to it. Cataract is a beautiful surgery. In 15 minutes, you'll finish with the blindness. It's the heaviest cause, look, going back from the expedition. She's in front, no need no more for sticks. She can even run, as you can see there. It's beautiful. Because we've been doing this for long. We have over 10,000 surgeries. So we've been doing this, and this really transforms the lives of people. Like little Sarah, who couldn't see anything, and she's right here now laughing and playing and whatever she needs to do, a child needs to do. This is another girl. It's Danielle. She was the diabetes that I told you before. 4 or 5 years no see. This is where our hospital is. You see, they all live in hammocks because that's what they're used to. So we adapt ourselves to what they want. We don't give them beds when they are used to sleep in hammocks, or we don't give them hammocks when they're used to sleep in bed.
Fazia tudo dentro de casa. Tinha 2 crianças, inclusive um filho de 2 anos que ela nunca viu. Então operamos o primeiro olho e foi emoção de todos, né? E principalmente de ver ela reencontrando o filho, que ela nunca tinha visto o rosto.
Second class, nothing. It's first class.
Agora ela vai cuidar dos filhos dela, ela pode trabalhar, pode ter a roça.
Eu tenho filho Johnny. Eu fiquei muito feliz por ver ele, porque eu nunca tinha visto ele na minha vida. Hoje eu estou vendo ele, graças a Deus.
Isso não tem dinheiro no mundo que pague. Essas são as gratificações que a gente recebe e que é por isso que a gente está aqui, né?
Isso realmente muda a vida das pessoas, né? Você voltar a enxergar e você poder carregar peso é um troço que...
You see, this during an expedition that takes 7 days, that's what we usually do. And we give those glasses here that I have. These are more magical than cataract surgery because you have kids that don't see well, and you just give them the glasses. We measure, and we have glasses from a -8 to +8, so we cover most pathologies of glasses. I can see here that at least 50% of us wear glasses. This is little Sarah. Oh. You see, we did already 55 expeditions, over 10,000 surgeries, and we donated over 8,000 eyeglasses. And in emergencies, we get together. Like Haiti, I went 3 days after the earthquake and stayed for 6 months. And then during COVID, we make a big thing on infirmaries all over the Amazon, 260 infirmaries to take care of indigenous people, so they didn't have to go to big centers to be treated. And then we had Mission Yanomami. I don't know if you heard about it, but Yanomami were very hungry because of the gold diggers and malaria, so their parents wouldn't feed them, and we're having around 1.8 kids under 1 year of age dying every day from hunger. This is in 2022, 2023 in Brazil, which is not a poor country. It's a developing country. It's absurd. It's out of control. And then in the floodings this year, we sent people to, all of them run away from their houses with no glasses. So we went to distribute glasses and medicine and pediatricians and general doctors and all that. This is inside the operating room. We have ophthalmology, general surgery, gynecology, dentistry, endoscopy, exams, ultrasound, labs. We take all that. It's like a hospital, like a normal hospital in the middle of the jungle. And we take care of people with a 500-kilometer radius that will come to us, or in helicopters, or in small boats, or in big boats, whatever is necessary. This is the eyeglass factory, you see? We do cholecystectomy too, laparoscopic. This was 1,000 miles away from Manaus. This is the program Forest Women. We have this telemedicine. You see the Starlink there, the little generator there, and we have agreements with universities. At Unicamp and Unimed in Campinas, where we have the doctors, the specialists right there. So when they pass by, they have the doctors, the specialized doctors that will take care of them. This is amputated kids that with snakes. They're bitten by snakes and they have no serum for venom, for the venom, so they are amputated. So we give them the prosthesis. This is in the Surucucu with the Yanomami that we set up. All this that you saw, this was built by us in 2 months. This is the hospital that we built in Campinas for the COVID with 122 beds, and we gave to the city. This is the infirmaries that we set up all over the Amazon. You see, we cover the whole place because we knew those people. We knew the logistics of it. The difficult part in the Amazon forest is the logistics, how to move people. They can be in beds like this kayapó or in hammocks. Come with us, help us. We need money, we need support, we need to put bathrooms, we need to clean water, we need to do all that in all the little villages that we go. I think you saw what we do. We have 7 employees. Thank you very much. It was a pleasure talking to you.